celebrate the 8th Annual Premature Awareness Day. November is Premature Awareness Month. And today we focus attention on what I'll call the plague that affects our country, called premature delivery. It's also today the 3rd Annual Premature Birth Report Card. March of Dimes looks at a number of variables and rolls out a report card every year during Prematurity Awareness Month. Grades are assigned based on the preterm birth rate relative to the Healthy People Initiative goal objective of 7.6% prematurity in America. I have some good news for you and some bad news. The good news is that 40 states in the United States of America, including Arkansas, did have an improvement in the prematurity birth rate. The bad news is that it wasn't enough. It wasn't enough to impact the grade that we were assigned. In terms of the United States as a whole, the aggregate, the preterm birth rate was 12.3%. That got us a grade of D. What would y'all do if your kids brought home a report card like that? Wouldn't be very happy. In terms of factors that are causal or associated with preterm delivery, there were 3 that we looked at specifically. Number 1 was the number of uninsured women among women of childbearing age. There was a worsening of that statistic in the U.S., up to 20.7% of women of childbearing age that had no insurance. Another variable is smoking among women of childbearing age. We actually had an improvement in that nationally, from 20% down to 19.6%. Not a big change, but an improvement. And then finally, a variable, late preterm birth. Those that are nearing completion of the pregnancy and delivered early. There was actually a national improvement in that number. What about Arkansas? Arkansas this year received a grade of F. That challenges me, and I hope it challenges you. We had, of those 3 variables that I mentioned, we had a worsening of uninsured women. We had an increase in the number of women smoking in childbearing age, and a slight improvement in late preterm deliveries. So the grade for Arkansas was an F, mainly because the preterm birth rate was 13.5% in Arkansas compared to 12.3% nationally. If you look at the U.S. as a whole and look at the red on there, if you can see that, you can see that there's a concentration in the southeastern part of the United States. And that's where most of the Fs reside. So we have work to do. So why is all of this important? Prematurity is the leading cause, the number 1 cause of death in newborns. There are 500,000, 500,000 premature babies born in America every year. And of that 500,000, 19,000 will die. To put that in perspective, we're talking about wiping off the map the city of Searcy, Bentonville, or Van Buren. That's a lot of baby deaths. And those who do survive are subjected to all kinds of disabilities, including respiratory illness, cardiac disease, behavioral problems, neurodevelopmental issues, learning disabilities. The list goes on and on. So, it is a problem. Behind me today you'll see, and if you haven't had a chance, please look at them. We have stories of preemies born in Arkansas, and it tells their story. We call this the Wall of Hope. We'd also like to, at this time, the March of Dimes, thank those families that were willing to share their stories. They are heroes to us in what we call mission families. So what is March of Dimes doing in this battle? It's all about education, advocacy, and research. In terms of education, the March of Dimes is very active. We have developed a toolkit nationally, which is an educational tool that extols the virtue of trying to get to 39 plus weeks in a premature in a pregnancy. We have online resources Department of Health. They are true partners to us in smoking cessation programs. And we also have the NICU Family Support Program. That is a national March of Dimes program and is present in over 75 hospital NICUs across the country. We have one of those right here in Arkansas at UIMS. In terms of advocacy, what does that mean? It means we advocate for pregnant women and newborns. In the political arena, we've been very active in the goal to ensure all women of childbearing age. Also, for the solicitation of dollars to fund educational programs and address the scourge, this plague of prematurity in America. And finally, research dollars. The March of Dimes has put millions of dollars in the last decades into research that directly impacts prematurity prevention and the treatment of sick newborns. That's a big deal. Every day that I work in an ICU, I utilize tools and techniques that have been pioneered by the March of Dimes. At this time, I would like to introduce a few of our partners, and we really do mean that, in the Arkansas Department of Health. We have two speakers here today. One is Dr. Grimes, who's with the Arkansas Department of Health. He's the branch chief of family health in the Center for Health Advancement. He'll be followed by Dr. Carolyn Dressler, who is the branch chief for tobacco prevention and cessation with the Department of Health. So at this time, I'd like to introduce Dr. Grimes.
Thank you all very much. I appreciate the honor to be able to talk to and address this group. As all of us know, babies are very important. Being a father and a grandfather, that is very important to me. And we know how much problems we see from the babies that deliver prematurely. Unfortunately, the majority, we still are not able to determine why women go into premature labor. And we don't really have that many solutions to the problem, although we're certainly continuing to look for them. I think what's important is for us to get out the message of the things that we do have control over. And those are three very important points that we need to be sure to tell all our friends, our neighbors, and our relatives. So in order to prevent premature delivery, we need to do three things. The first is to stop smoking and drinking alcohol for the women before you get pregnant. To also make an appointment and see your doctor before you decide to get pregnant. We know that we can prevent open neural tube defects, or what we call anencephalic babies, the babies that are born without a brain, the babies that have the open neural tube defects. Through the help and support of the March of Dimes, we've found that women, if they will take folic acid while they're trying to get pregnant, and even the year before they get pregnant, can greatly reduce the risk of that occurring. The next thing is a convenience. A lot of times it is easy if your mom has to be here to help you out with the new baby, and you're going what you think is a little past your due date, or she is on a deadline. We sometimes get pressure from our patients to deliver us a little bit early. Doctor, my mom has